It's flu propaganda season. You're seeing it everywhere. Get your flu shot. You're being offered inducements, say $5 off your groceries for this flu shot, or $10 for this, or 2 movie tickets for your flu shot. That's so wrong for many reasons. But what we want to discuss today is the question that is common in the office of, should I get the flu shot? So how do I answer that? That's what we'll get into. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Whenever anyone asks me whether they should receive any type of vaccine, my answer is, I think you should educate yourself thoroughly on the risks and benefits, and then make your own decision. Now, when you look into the flu shot, the influenza vaccine, there are multiple of them, different forms, and you really want to consider the risk-benefit ratio. You want to compare the risks to the possible benefits. So let's take it in reverse. What are the benefits of getting a flu vaccine? If it works like it's intended to, then you theoretically won't get the flu. So at maximum benefit, the flu vaccine will protect you from 7 days of feeling uncomfortable, maybe some vomiting, maybe some diarrhea, max, okay? If you get the flu, you have 7 uncomfortable days, then you're over it and you're good. Nobody dies of the flu as the cause unless they're very immune compromised already. And again, the flu is opportunistic. It wasn't the cause of death. The immune compromise was. So those people had other issues. But if you're a healthy individual, you're not going to die of the flu. So then we must say, well, what are the risks of the flu shot? Well, you have to understand that the flu vaccine each year is a guess. They're picking a couple strains, like 3 strains out of dozens of possible flu viral strains that could be present that year, and they're putting them into the vaccine and hoping that they guessed right as to which ones were going to be prominent that season. How do we know this? Well, if you look at the statistics at the end of each year for the efficacy and the effectiveness of that season's flu shot, the numbers are always abysmal. Basically, they're so bad that you are better off not getting the flu shot, because getting the flu shot wasn't preventing the flu at all, but it was coming with the risks of adverse side effects, etc. So what can happen if you're not getting any benefit and all risk? That right there pretty much says, why would you get the shot? But what are the risks of the shot? Well, this is where you want to go on the CDC's website and look at the ingredients in the various flu vaccines. And if you look at them, you'll see that multiple shots contain mercury. Multiple shots contain egg proteins, and many people have sensitivities or allergies to eggs. Many of the shots have formaldehyde in them, which is a carcinogen or can cause cancer. Many of the shots contain antibiotics like neomycin and gentamicin. One of the shots contains kidney cells from dogs. So these are all things that you must ask yourself. A, why are they in the shot? And then B, do I want these injected straight into my body? Because if you do, they can become antigenic and lead to cross-reactivity and inflammatory disorders, autoimmunity, etc. Look up Asia syndrome, adjuvant-induced autoimmunity associated with vaccinations. So these are things that you must consider and inform yourself on when weighing the question, should I get any vaccine or not? Today's video is specific to the flu shot. If you want to prevent the flu, then you need to optimize your health, optimize your immune function heading into flu season. One other thing to consider is there's been multiple studies done on people who received the flu shot versus people who don't. And there's been multiple studies done on people who received the flu shot and then looking at their risk for infection after receiving the shot. And what they find is that the people who received the flu shot are at a higher risk of non-flu viral infections after receiving the shot compared to people who never get the shot. So you may be thinking, well, I want to get the flu shot so I don't get the flu. Well, if by chance the flu shot worked for you, you're still at higher risk of viral infection from all other things, not the flu, after you get the shot. So these are some things to consider, to look up and read when trying to make the decision, should you get the flu shot or not. And remember, the flu is going to give you 7 or so uncomfortable days. And if you arm yourself and build your immune system, you can avoid the flu without a flu shot and avoid the other viruses as well that are around this season. So you want to look at things like vitamin C, you want to look at things like astragalus, you want to look at things like oregano and berberine, you want to look at things like colloidal silver. All of these natural methods can promote your antiviral immune capacity and help protect you from those 7 uncomfortable days.